Hello, very good morning to you. Welcome to Breakfast with Dan Walker and Louise Minchin.
The headlines for you at just gone 7 o'clock this morning. Coronavirus tests will be offered to care home staff and residents as the government moves to tackle the mounting number of deaths in care homes.
You don't have time to grieve for one, that you're losing another one and another one and another one. It's horrendous.
Labour leader Sir Keir Starmer urges ministers to publish their exit strategy from the coronavirus lockdown.
President Trump suspends funding for the World Health Organization, saying it's failed in its basic duty during the coronavirus pandemic.
Good morning. 3.4 million Britons out of work, the biggest economic downturn in more than 300 years. The bleak predictions on the impact of coronavirus on our finances and the hopes of bouncing back.
Off the road, but still pedalling, former Tour de France champion Geraint Thomas has a new challenge and he is really putting in a shift. He's going to tell us all about it later in the programme.
He set out to collect £1,000 for the NHS. Now he's on over 4 million. War veteran Captain Tom earns praise from around the world for his fundraising efforts.
Good morning. It's the 15th of April. It's Wednesday morning, and all care home residents and staff in England who show symptoms of coronavirus are to be offered a test by the government.
It comes after outbreaks were confirmed in more than 2,000 care homes. Providers say more testing is vital to control the spread of the virus and to enable staff who are self-isolating to return to work. Keith Doyle reports.
We'll be there with you.
With no family allowed to visit their care home, it's care workers that read the last messages from loved ones.
For now, Grandma, this is goodbye. But I know that you will always be with us in our hearts.
We've all got on with it and done what we can. And I can sleep well at night knowing that I did give them all the love and care that I could in their last moments.
The exact number of deaths of care home residents due to coronavirus is unclear. There has not been routine testing, something care homes have been calling for. The government has now said it will test all care home residents and staff in England with symptoms. It's also said all new residents discharged from hospital into care homes will be tested. Further details will be in the Social Care Action Plan to be revealed later this week, with 30,000 care providers expected to be contacted by the end of the week, according to the government. Deaths in care homes are not included in the official government figures. The latest number of deaths of people with COVID-19 in hospital has risen by 778, bringing the total to 12,107. The cost of the virus has also been laid bare. The economy could shrink by 35% by June, according to the Independent Office of Budget Responsibility, with the effects felt by everyone.
These are tough times, and there will be more to come. As I've said before, we can't protect every business and every household.
Labour says it's critical that the government gets the measures right, and even some Conservative MPs believe it's struggling to get all of them in place.
I've no doubt that government is being bold. It has come forward with the right basic approach, but because it's having to happen at pace and a great scope, it is clearly struggling in some areas.
Getting businesses back open, getting people back to work, getting care workers tested, getting through this pandemic. These are the challenges facing the government and the country in the weeks ahead. Keith Doyle, BBC News.
Well, that gives you a picture of how things are this morning. Let's get the latest from our political correspondent Nick Eardley, who's in Westminster. Nick, good morning to you. We've got a couple of political interviews coming up. We've got Sir Keir Starmer shortly and Helen Whately, the Care Minister, to speak to this morning as well. But there's real pressure, isn't there, on the government at the moment about their plans for the care sector?
Yeah, hi Dan, there absolutely is. I mean, we've seen this over the last few days. Some care homes saying that they don't think they can get the protective equipment that they need, and also raising concerns about that testing issue. Testing's been one of those things that we've heard repeated questions asked about. The government really wants to ramp up how many people it can test to 100,000 by the end of the month. And this initiative announced today is part of that, making sure that everybody who's leaving hospital to go back to a care home is tested, so that if they're positive, they don't go back to the care home. You can stop the spread. Also, everybody with symptoms in a care home being entitled to a test as part of that ramping up, again, to try and stop the spread. But again, I suspect that people in the industry will want to see that actually happening in some results before they celebrate this latest plan. Just on Sir Keir Starmer as well, it's worth pointing out that he's trying to put pressure on the government on something else, to give us more details about how eventually the lockdown might be lifted. Now, we know that that's not going to happen imminently. The government's made it pretty clear that they don't think that we've reached a peak yet, so to talk about ending restrictions would be a bad idea. But the Labour leader is saying that the government needs to provide a bit more detail of what it's going to base its decision on, about how it might eventually lift the lockdown, and what areas specifically might see restrictions lifted first. We know some European countries, for example, are allowing some schools to go back before, say, opening pubs or restaurants. So he wants more details of that. I suspect the government does want to do that, but at the moment it just doesn't feel it's in that place. It's saying that it thinks it would confuse the message by talking about lifting restrictions now, when it's trying to say to everybody, still, just stay at home.
Yeah, much to think about. Thanks for that, Nick. And Nick mentioned Keir Starmer there. We'll be speaking to the Labour leader in just a few minutes' time for you. And just a reminder, the Care Minister, Helen Whately, 7:30 on Breakfast.
Also today, President Trump says he will withhold funding for the World Health Organization, claiming it failed in its basic duty when responding to the pandemic.
Mr. Trump accused the organisation of failing to investigate the outbreak in the Chinese city of Wuhan, where the virus first emerged. Our North America correspondent Peter Bowes has the story.
The President of the United States.
Addressing reporters in the Rose Garden at the White House, President Trump said the United States was making substantial progress against the coronavirus. He could see light at the end of the tunnel. But it was time to call an end to America's support for the World Health Organization.
Today, I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there.
Mr. Trump said the WHO had promoted what he called China's disinformation, leading to a wider outbreak of the virus than would otherwise have occurred. He claimed the disease could have been contained at its source with very little death if the UN agency had objectively assessed the situation on the ground.
There was credible information to suspect human-to-human transmission in December 2019, which should have spurred the WHO to investigate immediately.
Responding to the president's announcement, the United Nations Secretary-General Antonio Guterres said it's not the time to reduce the resources for the operations of the WHO or any other humanitarian organisation in the fight against the virus. It's my belief that the WHO must be supported, as it is absolutely critical to the world's efforts to win the war against COVID-19. Critics in Washington say the president is trying to deflect blame for the spread of the pandemic in the US. The Trump administration has been criticised for a lack of early testing for the virus and for playing down the threat of COVID-19. Peter Bowes, BBC News, Los Angeles.
That's a picture from America this morning. One of the first countries in Europe to impose a lockdown is easing restrictions from today. Children in Denmark will return to primary and nursery schools 4 weeks after they were closed. Other restrictions on borders, leisure venues and gatherings of more than 10 people remain in place at the moment. The number of hospital admissions there has fallen since the beginning of this month.
The German Chancellor Angela Merkel will discuss possible ways to ease the lockdown with regional leaders today. Our correspondent Jenny Hill is in Berlin for us, and I suppose the question, we'd like to know here, but also what's going on in Germany. What are the chances of restrictions there being relaxed?
I think the chances are high, but it may take a little time. Germany's strategy appears at this stage to have, broadly speaking, worked. Mass testing combined with an effective lockdown that's been in place for around about a month. So infection rates have now slowed, and crucially, capacity in hospitals is still there. A group of leading German scientists have now recommended that restrictions be gradually relaxed, beginning with the phased reopening of schools. Angela Merkel has said over the last few weeks several times that as someone who grew up behind the Iron Curtain, she doesn't like the imposition of these kind of restrictions, although of course she has deemed them necessary. But it's not actually her decision to make. That power lies in the hands of the prime ministers of Germany's 16 states. She'll meet with them this afternoon. They do disagree broadly on the timetable of any kind of relaxation. But broadly speaking, we do expect to see perhaps schools opening first, maybe then shops. We've seen something similar in Austria where people are told they have to wear face masks if they're going to go shopping. A gradual return to normal. One point to make though, Mrs Merkel and some of the scientists advising her are very keen to stress that they think it's very important that younger people shouldn't be allowed to go back to life as normal if it means that elderly and vulnerable people have to remain in lockdown.
Jenny, thank you very much. Thank you.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.